does a variety of things. We do these healthcare activities. We do animal keeping, that is piggery, goats, poultry, dairy, cattle, and the like. So my presentation is on cancer prevention, cancer primary prevention, a comprehensive approach integrating awareness, health promotion, drug and substance abuse control, vaccination, and antimicrobial resistance. So basically, my work is to look at the preventive side. First of all, we look at awareness. With awareness, our organization works with Baylor Uganda, Pathfinder, and Milestops in delivery of such kind of services, especially in family planning, cervical cancer screening, HIV testing, and we do much on these NSA, non-communicable diseases awareness, especially in preventing these people from the community from getting these diseases. Like during that time of screening, we identify some other people who could be positive, maybe like in cervical cancer screening. We send them to referrals, and then they get treatment. I'm missing my pictorials here, which will be clear on those activities, on how we do it. My presentation is much more with pictorials. And in prevention also, we looked at the health promotion. In health promotion, we looked at giving information that promotes some of activities that would prevent these kind of non-communicable diseases. For example, we do promote activities like physical activities, use of proper diet, use of like we move even to health facilities, trying to educate health workers. Like as we are hearing from our presenters, that now in facilities some of the health workers have lost some of the skills. So as the organization will go in with technical people to educate them, to remind them actually, it is reminding them about these risk factors if they would be incorporated into their activities. Take for example, like dietary information. If we look at this smoking, if these people would incorporate it into their daily activities and they give it to the clients when they are trying to give treatment, I think this also would help to reduce on the problem of, I don't know why the IT is not getting my slides on screen. Yeah, so we are looking at that intervention. Basically, our approach is to look at integrating everything together: motion, drug and substance abuse control, vaccination, and antimicrobial resistance. The rest I talked about is, you can move the slide. I may not go much into the details of the background for the matter of saving time, because we have had much about that, the NCDs and the types. We have, you can go on the slide. My area of concern is going to be on this point of 17 million people dying from NCDs before the age of 70 years, and we are seeing 86% of these premature deaths occurs in low and middle income countries. Automatically, this, when you see such kind of percentages, it causes a global call for intervention. So, as the organization, Processor Community Development Organization, we had to get some interventions. Get to another slide. in order to combat this through the use of preventive measures. Another slide, please. Yes.
Yes.
In the point of awareness, as I earlier told you, we work with support from BEILA, Pathfinder, Milestones, Uganda, and local government to do some of these community activities. And our main concern is integration of most of these activities so that we can give the message at once. Like in the pictorial here, we were in one of the communities doing family planning, doing cervical cancer screening, HIV screening. We would take weight. We would also do some kind of health education. And in the process of health education, we would give basic information in prevention of these NCDs, like awareness about not to use, take a lot of alcohol, not to smoke, to have physical activities, and the like. And in that process, if we use that approach of integrating some more activities together, you see the number of people come than working on one activity which would not bring this number together. That website you see, I think it can take you to our organization, what we do, because I told you we do a variety of things. So if you can log in that website, it can show you what we basically do in Western Uganda. Go on. In the point of health promotion, we, Busia as a community development organization, tried it out to move to facilities, to try to give some information to health workers on how best they can do it with using preventive measures to combat these NSAIDs, like promoting regular physical activities, a balanced diet, smoke cessation and stress management, also collaborating with communities, schools, workplaces, and healthcare providers. Now, with this approach, we saw it better if the health workers are given this kind of information, this kind of intervention, because they are directly concerned. They receive these patients on daily basis. This message can easily go to many people, and you find when these non-communicable diseases are put down. Another slide, please. On the side of drug abuse, drug and substance abuse, in the same process, when we do enter the community, the way the people come, then we are able to select some groups that we can deliver to the relevant information. Take, for example, like the information of implementing measures to prevent and control use of tobacco, alcohol, and illicit drugs. We look at some targeted groups when we are there in the community, providing education and support for individuals dealing with substance abuse issues. So we as the organization, when we reach there down, we try to identify, even these communities are able to tell you that we have somebody there, the other side, who is an addict, who is bad love. So we go in as the organization, we identify these people, we link them to appropriate facilities where they can get better support. Another slide. I have 2 minutes, try to be quick. Then, vaccination, I think this is, as an organization, we do advocacy. When it is time for vaccination, for HPV, for hepatitis B, and these other immunizations, as an organization, we give in information to the community, we mobilize for them to come for the service. And microbial resistance, this is to do with health workers. Actually, now we are seeing a rise in self-medication. So if these health workers are being health educated about it, they can give appropriate information to communities who come just to buy, and then we can find a change within the community, hence reducing on drug resistance as a result of, please another slide, my 2 minutes are getting down. I have facts. Facts and finding, you have not seen it, but you'll go back a bit because it is very important. This is an extract from Busesa Medical Center 3, where we found out the number of hypertension in 1 year, that is last year, 396, 72 diabetic mellitus patients, and we have been running a program in the community of Kibale district for cervical cancer screening, and we found out 4 people who were positive out of the 7 sub-counties that were assessed. And these people were linked to Mubende Regional Referral Hospital, and they are reporting improvement. But we have a lot of story there which we can discuss if somebody wants the information, especially those who want to do research, who need to start this. We can share the information if needed. Move down. This is okay. Now, our organization work well with media. I personally, I give health education talks on most radios. We have one of Kabuza Development Radio for Minister for Finance, and this one Kakubira Community Radio for our Prime Minister. I even go to Bunyoro TV at times, giving reproductive health and the information about non-communicable diseases. So, for the matter of time, you can move on the last slide. Much as we are getting that, because for me I'm more practical, we have some challenges, like limited healthcare resources.
Like those ones?
Yeah, like those ones. Yes, you can go on, like that one.
Thank you.
There's another one like that one, which you have missed out. Please
don't.
And thank you very much for listening to me.